Hi, I'm Bob Falcone, CEO of the Columbus Medical Association and its affiliates. The CMA is an umbrella organization of affiliates who work on specific areas related to health in our community. The Central Ohio Trauma System is involved in trauma, emergency and critical care, and disaster planning. It has been essential in our pandemic response for our region this year. The Physicians Care Connection deals with underserved medically vulnerable populations. In addition, it connects the dots for people who need specialty care and newly pregnant women who need prenatal and postnatal care. The Physicians Leadership Academy helps to train mindful physician leaders for future positions of leadership in our community. The Healthcare Collaborative of Greater Columbus works on improvements in areas where there are gaps in our current system. Much of their work is systemic. The CMAF funds many of these organizations and other initiatives in our community. This year, we are focused on better coordinating the efforts of affiliates in the areas of overlap where we can support each other. For example, we have many physicians who work with the most vulnerable patients in our community. Here's an example of one of those physicians and how we might be able to help. Please listen to Dr. Joshua Joseph from The Ohio State University.
Joshua Joseph here. I am a physician scientist at The Ohio State University Wexner Medical Center. I run a research group that is focused on diabetes and cardiovascular disease from a lens of health equity. How can we improve health equity, not only in Central Ohio, but really around the world in these conditions? And then I'm a clinician as well. So I have a clinic focused on diabetes and heart disease and the intersection of the two. So how can we better prevent and treat both diabetes and heart disease? First off, let's talk a little bit about health equity versus disparities. So for many years, we've done work on disparities, showing differences in different populations, whether those be underrepresented communities or underinvested communities. And we know here in Central Ohio that we have many such communities. And much of that stems from the economic inequalities that we see around our great city. Where there are some areas where people are doing really well, and then there are some areas where people are frankly struggling. And so when we think about that and we think about health opportunity or the health opportunity index, what we see from that is that chronic disease rates are higher. That can be, hypertension, diabetes, obesity, where, we have a great focus. That can be heart disease, all the way out to things like cancer. And so when we're thinking about engaging around equity, we're moving the conversation from saying, okay, these are the communities or populations that are affected, to how can we engage and intervene to actually improve the health of these individuals in these populations. We need to understand what are the social determinants of health that are impacting our patients that we are seeing and the populations that we are serving. And what can we do to be a resource in order to engage around those social determinants, or what I will frame out as non-medical health related social needs. And that's another important differentiator, right? The social determinants are things that we really impact through policy. When we think about racism, discrimination, as well as poverty, these are things that really take, those are the most upstream of the social determinants and really take policy to solve. Whereas someone's social need or their non-medical health related social need is something specific to that person. So maybe it's transportation to a visit. Maybe it's that they don't have food to eat at home, which is critical in a disease like diabetes, where you're taking these medications that can lower your blood sugar, but if you don't have a meal with it, can cause dangerously low blood sugars, right? Or hypoglycemia. And so the social needs are really specific to the person. And I think that, one of the pieces that we're all thinking about is how can we engage to really not only address the social determinants of health so that we don't have to worry about social needs because there are none, right? That we really solve that challenge, but also in the meantime, how can we engage around those specific social needs? And we envision that in kind of multiple ways. But one of the definite pathways that we are looking at is the community hub model, right? So how can we make that referral, get folks into the community hub model where, they can do an even greater assessment of social needs, right? And then put them into the pathways to address those needs. The great thing about that hub model is that, the community care agencies are paid for this, right? They close the loop. If they address that social need with that patient, with that client, there's a payment that comes back from the state. So this kind of speaks back to policy, right? We have great policy at the state level to have these payments. Not every state has this. We really are pioneers within this area. And look, as an individual clinic, you don't have to connect with every hub. You just need to connect with the hub that's in your area, right? Make that connection. And then once that connection's made, the great thing is the hub kind of takes it from there, and is able to engage with the individuals around those social needs. So I'll actually use a community model and talk about some of our community work to show you how this hub works, right? So we talked about, you got to get outside of those four walls and into the community. We know that there are many groups that are disadvantaged from a health perspective in Central Ohio and throughout Ohio. But when we look at, all of the data on all the groups, there's one group of individuals and one population that is most disadvantaged, and that is Black men. Black men have the shortest life expectancy in Ohio. And even with the pandemic, there's a paper that was released just this morning, a national paper just this morning, that showed that during the pandemic, there's been a greater reduction in life expectancy among Black men than any other racial, ethnic, sex group, right? So even in the pandemic, we are feeling this, we are seeing this. Right, so we chose, myself, Dr. Daryl Gray, Dr. Tamaya Nolan, in collaboration with the African American Male Wellness Agency and many community partners, including the Healthcare Collaborative of Greater Columbus, to take on this challenge and to co-develop programming with communities, community members, community stakeholders, and community organizations to address health in Black men. In order to address health in Black men, we knew it was more than doing kind of education and lifestyle change. We had to talk about some very uncomfortable stuff, right? A history of medical mistrust that's been driven by the healthcare community, right? We had to address that. We did implicit bias training as part of the program. We did provider-patient engagement and patient-provider engagement. We both worked on both sides. And this wasn't just Ohio State, this was Ohio Health and other healthcare organizations here in Central Ohio, all partnering together on this effort, right? And we combine that with knowing that among this community, we had to address those non-medical health related social needs. So we did screening for the social needs, referred them to the Healthcare Collaborative of Greater Columbus. Individuals were able to work with community health workers here locally, get placed into the pathways, and then get the care that they needed. And that care was multifaceted. It went from everywhere from food insecurity and addressing food, all the way out to connecting with healthcare providers. We had gentlemen who had not seen healthcare providers. I can't speak about specific stories, but we have men who are now in care and in very high quality care, getting very serious concerns addressed that probably would not have known about that concern without the program and without the connection to care that we were able to facilitate through the connection with the Healthcare Collaborative of Greater Columbus. And so once individuals get this care, it's life-changing for them. It's life-altering for them. And that is the opportunity that we all have, right? Not just thinking about the person as a patient in front of you, but as a human being, right, who should have every opportunity to have the best health that they can. And without addressing those social needs, we are not giving them that opportunity. So it is upon us to work with them together in order to address these social needs.
At the CMA, we know Dr. Joseph's experience is not unique. One of the most challenging parts of being a physician is working with patients with complex medical needs and social inequities that make it very difficult for them to get the care that they do in fact need. The Columbus Medical Association will continue to represent Central Ohio physicians. We'll work closely with state organizations and specialty societies to make sure that we're upfront and part of any discussions that affect the practice, the patients, or the community. Leading these efforts is our Public Policy Committee, chaired by Dr. Bill Cotton and Dr. Stephanie Costa. You'll hear from both of them on the next segment. In addition, we'll introduce you to our expert consultants These include Carrie Baker from HCGC and Malcolm Porter. Till next time, this is Bob Falcone, Columbus Medical Association.